Hello friends, a lot of people ask me why don't I make my videos in English. So today here it is for you. I personally feel that maybe I'll be able to reach a better crowd, a more crowd when I talk in Hindi, and I'll be able to explain it better to you in your own language. But okay, let's start it in English this time, and if you all find it easy and simple to understand in English, I'll make the videos in English from now on. So the most important topic and the most important thing that patients come to us for a routine checkup, or they come to us for cavities or cleaning of the teeth. As soon as we see that there's a missing tooth, we advise the patient to please get that missing tooth replaced. And instantly the patient says, हमें तो कोई problem नहीं है doctor, I am able to eat properly, why do I get my missing tooth replaced? It has not been there for years. I have no problem. So why do you want to replace it? Do you really want to know why we tell you to replace the tooth? It is not to fill our pockets, please. It won't make a difference to us, because sooner or later you will come back to us for that tooth, and trust me, we'll have bigger money to make then. But why do we tell you to replace the tooth? Now understand, eating and biting is not the only function of your teeth. It is just one function. Okay, so don't think that if you're not able to eat tooth, you do not need a tooth. And how will it cause or affect you in the later run? You'll know it soon. Now I'll tell you, whenever the tooth goes away, what are the consequences that happen with the missing tooth? See, the teeth are like bricks in a wall. If one of the tooth goes, the integrity of the whole dentition gets mismanaged and it goes haywire. How? See, whenever there's a tooth that goes away, the adjacent teeth, the teeth near to it, slowly and steadily, won't happen in a day, but they'll start drifting into that space, because teeth are not fixed to the bone like a cement. They are fixed to the bone with the help of a ligament which is called a periodontal ligament. So there's a slight mobility in your teeth naturally. Okay, so whenever there's a tooth that goes missing, the teeth near or around it, they start drifting into that space. And because of that, all the teeth around, they start drifting. Now when they start drifting, what happens? You suddenly realize, I didn't have spaces initially in my teeth, but now I have gaps. The reason is this. Secondly, whenever there are gaps, they'll be sticking around a food inside it, and that will lead to gums and periodontal problems. This is the second drawback. Third drawback. Whenever the space has been drifted, the tooth where the tooth was missing, that space has been taken up by the adjacent teeth because of the drift. Now over the years, when you come back to us to get the tooth replaced, we do not have enough space. So we'll have to do additional treatments to make the space for you, and then give you either an implant or a bridge or a RPT or whatever. But then we'll have to do additional treatments. That makes us more money. Okay? And the most important thing that happens is that bone where the tooth was, that slowly and steadily gets resolved. And when there's no bone, how do you think the teeth could be fixed? The new teeth, where will we fix the new teeth? The bone is very essential. And that keeps on resorbing over the time when the tooth is not there. And then comes the most important point. Please note this. The upper and the lower teeth are like this. Now if the lower teeth is missing, you are not having problem initially, but slowly the upper tooth will start moving downwards, because now it does not have a stop underneath it. Now when this starts moving slowly over the years, what happens? This tooth becomes loose because it is coming out of its bone. And this tooth and the tooth near to it, which were like this initially, now one of the tooth starts going down. There's a space that is created here between these two teeth. There'll be food going inside that space constantly. okay, and there'll be cavities because you're not able to clean it. Both the teeth will have cavities. Then you'll be advised a root canal treatment. Then you'll have to go for a capping. You'll have to get this tooth which has come down extracted. And now you need 2 teeth to be replaced because initially the lower one was gone and now the upper is gone as well. So now do you understand why we tell you to get the tooth replaced as soon as it is extracted for whatever reasons? Please make a note that we doctors won't advise you anything unnecessarily, and if you think we are making our pockets, we have bigger pockets coming up. So for your benefit, please think about it and trust us, we won't misguide you. Thank you. Hope that helps.